here today discussing successfully approaching and implementing a value-based care future with Bill Bysinger. He's a 35-year healthcare executive, former medical school professor, healthcare technology entrepreneur. He's authored multiple articles on healthcare change, policy, and industry evolution. He's a HCIM Senior Strategic Advisor and a member of the Healthcare Strategic Advisory Council. So with his thoughts, here's Bill.
Thank you. In order to successfully approach the concept of value-based care, we need to think about what was the driving force behind CMS and the federal government moving to this model. It really is the patients who are driving the demand to be more included in the process. Patients are demanding better access to information, better access to care and more choices, the ability to be able to have transparency from providers and plans, and they really want to be part of the process, not part of the problem. The healthcare industry needs to respond in multiple ways to this new transformational change that's taking place. However, at the same time, the industry's got to overcome some of the fundamental problems that have created the difficulty in transforming. Those problems being, one, data integration continues to be difficult. There are multiple systems with multiple formats of data. The electronic health records don't talk seamlessly to each other very well, and other systems on the payer and provider side do not talk well or integrate the data into information successfully across the continuum. So that's a serious problem. Patient engagement, although a lot of movement has been made to include patients more, give them more access using the web, patients still are demanding more information to be involved at every area of point of care, as well as from their environment that may be at home when they need to access their healthcare records. Cost containment is basically in many organizations non-existent. It's very difficult to get to capture the cost of care or the cost of operational processes during the execution of those processes. And therefore cost accounting, which is traditional in other industries, has not really been well established or implemented in the healthcare continuum. And therefore costs are an elusive problem. As the same is quality management, which is something that's been talked about for the last 30 years. But the dilemma is that the metrics have been difficult to report on and accumulate data to support it best. And recently the CEO of the Cleveland Clinic said that he believes there are way too many metrics that healthcare organizations, providers are being asked to report on a monthly, quarterly, or annual basis. He just believes they're getting in the way of good care. So these are the challenges that the industry needs to address and your organizations need to address on how you're going to move to value-based care. The fundamental foundation of value-based care coming from CMS is provider-led health plans, and this concept that Medicare and Medicaid over time will be driven by organizations that are provider-led. This movement's been going on for the last 20 years. Many states and the insurance commissioners within those states have developed regulations to be able to manage the process of the movement to a provider-led health plan. When a provider engages in risk, they become part of a model that looks very much like a health plan. So the rules and regulations are being defined for these models by state insurance commissioners. The role of the provider clearly, when we talk about a provider-led health plan, changes dramatically in this new world of value-based care. Providers need to be much more involved and more directed and focused around this idea of contracts, of process improvement, around cost containment, and about sharing risk. Once the providers are sharing risk, they actually are part of the payer process. Providers need to take responsibility for the business side of the operation and put policies and procedures in place that address these issues. The present focus that everyone is trying to improve upon is wrapped around this idea of integrated care, which encompasses integrated medical management. And then at the same time, over the past few years, there have been new provisioning models that have arisen in the market. Urgent care facilities that are different than going to your family practitioner. The ability for patients to navigate through some of these models and these different venues. Ambulatory surgery centers are springing up all over the United States that allow patients to have surgery away from the hospital-centric models. So these are creating new models. There are many pharmacies. CVS actually are providing inside of CVS a mini urgent care facility. So a lot of these things are basically changing. The dilemma, again, goes back to data integration presents some major problems with these new models, and as well interoperability. We don't have systems that can connect seamlessly across geographies or even within the same geography, and we also don't have data that is easy to collaborate across a continuum to be able to get a total view of patient information. So policies need to be developed that can solve these decentralization care process issues. HCIM is directed around this idea of working with our customers and clients around the idea of value-based care transformation using a roadmap model. This roadmap model is designed to be able to assess the organization's ability to be able to transform over time to get to value-based care. And it identifies a number of areas for potential collaboration and systems integration. These value-based care checkpoints start with this idea of organizational readiness. Organizational readiness is an assessment of where the organization stands at this point in time. Who are the stakeholders that are involved in the processes that need to be brought forward? What are the venues where care will be delivered? What are the systems that are supporting those venues, those providers, those payers? How do we interconnect that information to be able to get to those models? And how do we identify the collaboration and systems integration necessary? So what the assessment does is really create a number of questions that need to be answered as an organization is approaching a set of projects to support value-based care transformation. Then we have this idea of operational strategies. Once we have the questions defined, we need to then start determining what are the strategies for operationalizing those issues that are going to be important to move to value-based care. Integration plans need to be developed. As I talked about, we've defined in the readiness side who's going to be involved. Now we need to start defining how are we going to interconnect. We need to define in that interconnection what are the processes and how do we improve those processes within and between organizations. Then we also need to start building a cost-benefit analysis model. We need to understand how we're going to define return on investment, what costs go into the return on investment model, what is the revenue that will be generated to offset those costs in the return on investment model, and how do we create the workflow integration to be able to support the cost-benefit models, the process improvement, and the integration plans. We recommend that as you are doing this, you look at 90-day project models to be able to achieve the ability to define and operationalize these strategies. The collaboration is critically important. Back in the 1990s, what actually killed the concept of integrated managed care organizations or integrated delivery networks was the collaboration became a stone wall between the payers and providers. One of the major issues was the ego-centric issue about who's in control and who's in charge. Egos need to be left outside of the conversation to get to value-based care. Really must be a collaborative concept, much like what King Arthur did with the Knights of the Round Table. The reason the table was round is to basically ensure that everyone believed that when they came to the table, they were equal in their ability to be able to make comments as well as be able to enjoy and join in the collaboration. There must be a focus on a win-win environment for everyone, including the patients. Remember, the patients are part of this collaboration, and they need to be considered as well. No one will survive, and value-based care will remain elusive if a collaborative model is not built between all of the stakeholders, patients, providers, and plans. Finally, we move to this idea of information integration. This is where we've identified the data, we've identified the sources, we've identified the technology, we've laid out strategies, we've developed a collaboration. Now what we need to do is to define how we're going to build an information environment that is patient-centric and delivers an architecture that gives those who are engaged in the care process and the operational processes the information that is available for them to be able to support good clinical decisions, support good operational decisions, and also support the quality management and pay-for-performance models that is driving this new value-based care concept. The information architecture provides the ability to report on valid patient data, to apply analytics, to achieve predictable outcomes analysis, and to deliver better continuum care. And another way to look at this really is an infrastructure value-based environment. And this is a model of an infrastructure that we at HCIM have developed in conversations with many of our clients and people within the industry. It really is this shift from volume to value changes the dynamics of how organizations need to be structured. The underlying capabilities or the base foundation needs to be really good technology efficiency. On top of that, that efficiency supports process improvement, and from process improvement we get internal quality as a focus. In the middle of this infrastructure are the revenue and expenses that need to be maintained and are consumed to be able to be successful in the market. Medical expense on one side, operational expense on the other side, and in the middle, appropriate revenue. Taking the expense and using it to determine what is the appropriate revenue that needs to be charged for whatever processes we are performing. At the top of all that, the thing that gives us visibility on how we're doing is population analytics on one side and care quality metrics on the other side. We marry population analytics with care quality metrics, and we now have an infrastructure that allows us to be able to move to this new value-based care model. The idea that this presentation is all about is you as an organization's ability to be able to determine how you need to move to this new value-based care environment in a methodical way, and understanding that this is an overtime, not an overnight success, as well as there is no single silver bullet process or model that's going to help you. It's going to be based on the type of business that you're building and the type of care environment that you want to implement to be able to support value-based care. Thank you.